Hey, this is Dr. Christy Mauldin, and today I would like to talk to you about my Neuropathy Secret program and talk to you about what I've done in the past and what has brought me to this point. So basically, I'm a doctor of chiropractic and I've been licensed since 1999. I have had practices in North Carolina, California, and Florida, and also in Italy. As of right now, I'm still licensed in North Carolina, and I work and have two practices in North Carolina and in Italy. I've done over 500 hours of continuing education in functional neurology and functional medicine, and I've had a very strong focus in peripheral neuropathy since 2014, where I have focused on nutrition and balancing blood work using functional medicine with supplements. So let's get started. So here you can see a testimonial from one of my previous patients that I had in North Carolina, Sylvia, and she wrote, I was so pleased with Dr. Mauldin's neuropathy program. The numbness and tingling in my feet and legs went away. It even improved my balance. Please give her a try. She also has done a video testimonial that you can see on our Facebook page if you're interested. So the first thing that we really need to talk about is how does peripheral neuropathy develop? So if you look here, you can see this is a spine from the brain that goes all the way down the spinal cord, and then the nerves branch off, and we have branches of nerves that go down into our hands, down into our feet. You can see here the longest nerve in the body is the sciatic nerve, and it has branches that go out all the way down to the feet. So it's a very long distance from the heart, which pumps all the blood all the way down to the feet. So again, continuing on here, you can see that this just points out all of the nerves and how they all branch off. So the main purpose is to get blood flow from the heart all the way down to the feet to supply nutrition and oxygen to the nerves. And this is super important when you are talking about neuropathy. If you look at this little inset picture here, this is taken out of just an example of what the nerves would look like when you're looking at peripheral nerves. If you look here, there's a myelin sheath, which is a protective covering around the nerve that allows for conduction or electricity or velocity to go across that sheath and to send a signal from one end of the nerve to the other. When you look at this one, you can see that there are little pieces that are cut out of it, which means that this nerve has been damaged. And so the electrical impulses are not able to travel across that nerve effectively. And when that happens, this is when you start to see symptoms that we will discuss here in a few minutes. Okay, I love this picture because this totally represents how the nervous system and the nerves and the blood flow work together. This lady is here watering the roots. The roots represent the blood vessels, okay? And when you water the roots or the blood vessels, then what happens? Then it supplies the nutrients for the leaves or the nerves to flourish and be able to function normally. So you get water, you have a nice function, and you have leaves or nerves in this case. What happens if you do not water this plant? The nerves or the leaves will dry up and wilt, and they could completely die. So if it's mildly dry, then all you have to do is just give it a little bit of water or some Miracle-Gro, and this plant will flourish. But if it's too damaged and it's completely dried up, it doesn't matter if you gave it the best soil, the best Miracle-Gro, the best water, the best anything, this plant would completely die. So the same thing goes for nerves. So when somebody comes to see me, sometimes they are beyond repair. So I hope that whoever I'm talking to is not at that point, because sometimes nerves get so damaged that people have to have their legs amputated. And when this happens, it is not nice. I have a cousin who has lost I don't know how many toes and from diabetes, and it is not a nice thing. So I don't know how much a person can actually put a price on a toe or a leg or a hand. It comes down to getting the proper nutrition and the right fuel for the nerves through the blood supply. So we'll talk about that here in just a minute. So when we talk about these damaged nerves, we want to know what causes neuropathy. Why do these nerves start to get damaged? Here you can see these are just examples that show that neuropathy usually happens in the hands and the feet when we're talking about peripheral neuropathy. And in this case, it looks like it's a burning type pain. It can be tingling too, but we'll talk about the symptoms in a second. So I think the most common thing that people think about when they think about neuropathy as the cause of neuropathy, they think about diabetes. Now let's talk about diabetes. When a person does not regulate sugar in a proper way and their pancreas is not able to make enough insulin to balance out, that's a whole complicated story and how diabetes works we will not discuss today. We just want to talk about the basics. But if you look here, a normal nerve, the yellow part here, this is a normal nerve that is encapsulated with this blood flow from the top to the bottom. It covers everything. So if there's any nutrition that needs to be carried through the blood vessels to get to that nerve, it will get there because it's completely covered. Now you can see here, it becomes diseased. And so there's not enough nutrition getting to the end of the nerve. And so the blood supply starts to pull back and starts to wither and die and pull away from the nerve. And eventually, there's no blood supply whatsoever. There's not enough circulation and blood flow to go to the nerve. So the nerve completely shrivels up and dies. So this is super important. And this happens with diabetes. It starves the body of the circulation. So let's talk about that in just a second. So here is the next thing as the most common causes of diabetes. So it can be from poisons and toxins. I've seen patients come in with some type of insecticide poison. I've seen people come in from chemicals where they worked in plants. I've seen people who had Agent Orange damage that had complete destruction of their nerves. There are patients who come in with chemotherapy. There are patients who come in from damage from statin drugs, from taking cholesterol lowering medication. Aspartame is a neurotoxin that also attacks the nerves and causes problems with neuropathy. And then here, this guy's sitting on a bottle because he's battling alcoholism. I have seen every single one of these kind of patients come into my office. So now we know how neuropathy can develop. Now we need to look at the types of symptoms that you can expect to develop if you get it so that they can be warning signs to you that maybe there's something wrong and your blood supply is not working properly or your nerves are starting to be damaged. So here, one of the most common things that we'll see and what I hear is numbness or tingling or burning in the hands or the feet. You can also have all three of these. You can also have another thing that's not written here. You can have a freezing sensation. I've had people tell me that they put their hands in hot water, but it feels like it's ice cold, or they feel like their feet or their hands are on fire all of the time. These are all classic signs that the nerve is not working properly. If the nerve is functioning, you feel nothing. Your nerve does what it's supposed to do. It's when you have these altered types of sensation that tell you that something is not firing properly. So here is something that becomes more severe. It becomes more of a neurological issue when it starts attacking the brain, and your brain is no longer in connection with your feet. So if your brain does not know where your feet are, and you're now dizzy, then your feet, you misjudge steps. You might run into things, you might trip over. It could be just a stone on the street, or it could be a curb. It could be anything because your balance is off. Then what happens is you start to fall. Why is this so important? I cannot stress this enough because think about this. You have to have blood flow in your body to nourish these nerves. Well, you also have to have blood flow to the bones. So let's say that you have a balance issue and you fall and then you fracture something. You fracture your foot, okay? If you're like 10 or 15 years old, you fracture your foot, it heals in about 5 to 6 weeks. That's not the case if you have no blood flow because then the blood is not able to send what it needs to heal the bone that has been fractured. So then what happens? You have the dizziness, you have the balance issues, now you have a fractured foot. you're using crutches, you may have been using a cane because you could not walk properly. Then what happens? Your foot does not heal. Then you might go to a wheelchair, okay? Then you might go to a bed. Then you might go to a nursing home because if this does not heal, it could get infected and then you can have all types of infections there where it doesn't heal. And there are a whole lot of things that you have to do there to speed up the healing. But in a nursing home, I don't know about you, but when you go in there, a lot of people do not come out of there. So really think about this. If you're having any type of dizziness, do not discount it. If you're having any type of balance issues, a lot of times people say, oh, it was something in the way. No, it's because your brain is not able to react quickly enough to keep you from falling. If you actually fall, how many falls will it take for you to realize that something is going on? These are huge red flags. I could talk about this for hours probably, but I just want to stress this. It's super important that you take note when you are dizzy or have balance issues. So let's move on. Okay, another thing, we talked about it just a minute ago, like if somebody puts their hand in hot water and it feels cold. So this also happens, like somebody could be walking and they can't feel the carpet under their feet, or it feels like needles. I've had people say that when they put the covers on their legs when they're sleeping, that it hurts. The sensation is altered. The nerves are not able to carry a normal function. It's not able to send the right signal. It arrives at your brain. Instead of telling you that it's safe, it tells you that it's painful and it hurts. It's an aberrant communication going on. So what happens too is people go in and try to check water, maybe in the bathtub or in the kitchen. You can see this burn here. This happens a lot because your brain and your nerves are not communicating properly. This is again a neurological issue, but it is a huge red flag that something is aberrant and it's not working properly. So, this is something that I want to talk about that is a sensitive subject for a lot of men, and especially me being a female doctor. But what would happen is these men would start to tell me over the years, they would ask me, does this have anything to do with this? And so, if you look here at this picture, I really want to talk about this. This is called the homunculus, and this is like a map within the brain that shows where things are localized. I don't know if you've ever seen those videos where they do live surgery and they can poke something and the hand will move or the foot because it's localized. It's really cool how the body is made. But I want you to look right here. It says foot, toes, and genitals. Do you see how close that is? So when an exam is done and there's a loss of sensation at the big toe and at the ankle, there's a good chance that there's a problem also in the genitals. So this will cause erectile dysfunction. This is a big deal. And I'll tell you what, I had a man who was a patient of mine. He was in his 50s, I believe, and he was a nice looking guy. And I remember that he came in and he was really embarrassed. He didn't want to tell me, but he said, does this have anything to do with the neuropathy and not being able to, have an erection? And I said, well, as a matter of fact, and I showed him this picture and I put him on the program. And I'll never forget this man coming back to me. It was just a short while after, and he thanked me so much. And he said his girlfriend thanked me. So these are things that are sensitive, but they're super important. And it's not just in your mind. And it doesn't mean that you need to go take Viagra. This is something that actually is a clinical issue that can be coming from the neuropathy, and there is hope for it. So do not give up. Okay, so here is another thing. We talked a minute ago how signals from your feet to your brain are not, or from your hands too, are not arriving in a normal way. So what happens is your brain is constantly receiving this pain signal. So the pain is actually in your brain. So it's super important that once you find out that you have neuropathy, as you start getting pain, it's important to like re-educate those nerves and regenerate those nerves and help to retrain the brain so that we can calm down the fire and calm down the brain signal so that you don't always have the pain. And this is completely possible. So this is another question. So all the people that when they fill out applications to talk to me, I ask them, what have you done to try to help your neuropathy? And most people will say they've done physical therapy, they've tried creams, they've tried supplements, they've tried all different types of machines, they've tried stimulation, they're taking all kinds of medication, usually, and I'll go over the medications here in just a minute. They're the traditional ways of treating neuropathy. If they were working, they would not be calling me. So we're going to talk about that. So here you can see just a few of the medications that are most common. Gabapentin is probably the one that I hear the most about. I don't know if you know this, but this is actually an anti-seizure medication, and it's an off-label use when they give it to people for neuropathy for pain. It has a lot of nasty side effects. Amitriptyline, Lyrica, Cymbalta, maybe you're taking some of these. These are the most common medications that I see. And if they were working again, you wouldn't be here. So these are about side effects. It's like, do you want the neuropathy or do you want the side effect? You kind of have to choose because you're going to get one or the other. So this is a disclaimer because I really want to be clear about this. I am a licensed doctor of chiropractic, and my practice license is in North Carolina. So when people come to my office, it is a different relationship than with people that I have here as a health coach. So I want to be very clear that I'm not diagnosing your neuropathy. I am not treating your neuropathy, and it is very important that you talk to your medical doctor if you do any type of change. Do not go off of your medication without talking to your medical doctor. And I am a health coach, and what I will be doing is looking at the case that you have and looking at different things and giving recommendations, but it is always something that you should follow up with your doctor. So this is my disclaimer at this point. Okay, so let's talk about what is the neuropathy secret approach. So the first thing, number one here, is initial customized blood work to find out what some of the causes to your health issues may be. So you've tried physical therapy, you've tried these creams, you're taking medication, maybe you've tried some supplements, maybe you've tried some machines, but nobody has really told you exactly what's going on in your body at this moment in time. If nobody knows what's going on with your body and they just give you a supplement and they don't really know what they're measuring, it's no good. I'll give you an example. One time my vitamin D levels were too low. And I know this happens all the time. People come in and they say, "Oh, my doctor told me my vitamin D levels are low." And they just put them on vitamin D and they never check it again. And it's just crazy because your vitamin D levels can get too high. So you have to monitor these things. You have to know what is in your body. You got to know what your blood work is made of. I go back to that tree example again. If your roots are dried up, then you will have no leaves. If your blood flow is not proper, it doesn't have the right nutrition, if it has gas or if it has alcohol in it, then your nerves will not flourish. They cannot carry the signals the way that they're supposed to carry them. So the number one thing that I have to do, instead of saying, "Hey, you know what, Johnny, go take some vitamin D or take some B12 or whatever supplement it is," I want to know who you are. In this moment, we're going to do a complete blood work, not just 4 or 5 tests, hoping that we got the right ones. We're going to check everything to make sure that we have the right start. Okay, that's number one. Number two, customized diet and supplement protocol based off of your blood work. So after we get that blood work back, I'm going to put you on a program that's going to help to balance those things out. Then after that, in the meantime, you'll get on a customized therapy routine. So in my office, everything that I give my clients now to do at home is exactly what I did in my office, but now it's at a home base. Instead of you having to get in your car and drive 2 hours to my office, because I've had people drive several hours, even further than that. It's hard. When you come 3 times a week, you drive to the office, you're there for an hour and a half, and then you drive back. It's very exhausting. And most of my patients that have, or clients that have had neuropathy, they can't walk very well. They can't get around. They're falling. If there's bad weather, they can't drive. I've had patients tell me that they can't even feel the gas pedal anymore. This is scary. This is a dangerous situation. So in this case, I have taken everything that I did before and I've packaged it so that these people can stay home. You can stay home in your pajamas. And once your nerves start working better, guess what? You'll want to get out and you'll want to get back in your life and enjoy the hobbies and do the things that you were not able to do for a long time. I mean, how many of you now have to sit at home because you're not able to get out and play with your grandkids? Or if you don't have grandkids, you're not able to go be with your friends because you're in constant pain. So, this is a customized home therapy program joined together with the blood work, okay, and the supplements. This is a huge deal. So once you get all of this, you have a complete constant email support from me and my staff. At the end of the program, we will do a final customized blood work to recheck everything that was not normal from the first blood work, and then you will have those machines forever. It's not something that you lease, it's something you have forever. Usually people get to the point where they're on maintenance, they don't have to do it as much. The key with that is you have to make sure you continue with the therapy if you need it because you're going to be the one that's accountable for yourself at that point. So that's the only thing that I would tell you. Anyway, at the end of this, let's move on. So here's another testimonial. So I had gone to physical therapy and other doctors for my neuropathy, and they had given up on me. Before I came to your office, I did not have any feeling in my toes, and I had severe pains in my legs and feet. After seeing Dr. Mauldin, now my pain has gone down by 80%, and I can feel my toes on the carpet when I walk, whereas I couldn't before. Donald W. in Lexington. So now I'm going to show you a couple of videos. Okay, so you've gone through everything and here you are at the end. So everybody at this point, you either know you're wanting to do something, you're tired of it, you're sick and tired of being sick and tired. So you have neuropathy, you're not happy with your symptoms and you're seeking something else and you're seeking relief. Then you can schedule an appointment with me and we can go over all of this. Now, here's the deal. I used to offer a free discovery call, but what I found is that when people have something that's free, they don't show up. They don't really have any skin in the game, as we say. So, what I require, because my time is valuable, as is your time is valuable, I require a $99 deposit to reserve this spot, and it will be applied to any program or system that is recommended by me. But here's the kicker. If you choose not to continue with my program or you're not accepted into the program, because I will not accept everyone. I can tell you this. I have two small kids, and the last thing I want to do is try to drag somebody to the water as a horse and make them drink. So I only want people and I only accept people who are 100% committed to this and want my help because I can tell you if I'm in your corner, I will give you 150% of everything that I have. I will do everything I can to help you, but I will not do it with people who are not ready. And not everybody's ready. Maybe you're ready now, maybe you won't ever be ready, but maybe you'll be ready in a month or so. You think about it, things don't get any better. You realize you've tried all these over the counter creams and these machines and whatever it is, and nothing's working and you're tired of it. There is an answer, and it does not mean that you have to live with it. So that's it for this one. So that's it. So that's the end of my webinar. And if you have any questions, you can send it to us and we'll be happy to answer. And if you would like to jump on that consultation with me and see if I can help you, I would love to talk to you. So take care and I'll see you soon.